On this episode of 26 Minutes with Dr. Warren Siegel, I'm joined by Dr. Ashrei Bayewitz to discuss the importance of becoming a blood donor. We'll explore why donating blood is vital, who it helps, and how you can make a life-saving impact. Please join me in welcoming Dr. Bayewitz to the show. Thank you so much. I know how busy you are, and I'm so delighted that you were able to get us in today.
It's a pleasure. Thanks for having me.
So tell me a little bit about yourself. Where are you from? What do you do? What's your specialty?
Sure. So I'm from New Jersey, New York, broader New York area, and I work in hematology oncology for adults. In terms of about myself, I really love stories. I was a English major in college, and that actually got me into medicine. So I focus on illness narratives, stories patients write about their own illness, or physicians who write about treating patients with illness, and I really connected with that, and that drew me into internal medicine, which is treating the whole patient, and also hematology oncology. There's an importance with connecting with the patient, understanding them. I still try to read a little bit on my free time. So
I'm sure you don't have much of that, but tell me exactly, what exactly is a hematologist oncologist?
Okay, sure. Yeah, so it's actually two specialties connected in a way. So hematology is study of blood, and oncology is cancer. So I treat medically blood issues as a generalist, and also medical oncology. So it's a pretty wide range of different issues that can come up.
So your patients with oncology, they have cancer?
Yeah.
But you also take care of patients who don't have cancer but have blood diseases? Like, what kind of blood diseases might somebody see a hematologist for?
Right, so I mean, it's issues with the blood. So sometimes it's issues with some problem with the blood itself. So maybe sickle cell anemia, some abnormal blood cells. Sometimes the blood clots improperly, so like pulmonary embolism. And sometimes it's not so much a problem with the blood itself, but that they're not making enough blood, like anemia, maybe from low iron deficiency anemia. So it's a range.
So patients might see a hematologist, I think you said, if their blood clots too quickly or doesn't clot enough?
Yeah, that's also true. Easy bleeding, right, that's true. Hemophilia, that's another one.
So it might be something abnormal with the production, you said sickle cell, right? Or it might be due to their nutrition, like anemia?
Sure, yeah.
And what is anemia? Can you explain that?
Not enough blood.
Not enough blood, and why would somebody not have enough blood?
So I actually love talking to patients about this. I give them a metaphor of like a factory, imagine. So like blood is made, so a factory is not making enough products. Could be for different reasons. Not getting enough supplies, or maybe not a good work environment, let's say. So to make enough blood, you need supplies, you need iron, you need a certain hormone made by the kidney, erythropoietin, and you need a good, healthy body, not too much inflammation. And that's just to make sure there's enough blood being made, but sometimes someone can lose blood faster than it's made, like a bleeding issue, or like sickle cell, maybe destroying the blood cells, hemolysis. So yeah, it's different possible ways to lead to the same issue, which is anemia, not enough blood.
So let's talk about staying healthy.
Sure.
Obviously, that means I have to eat the right diet, I assume, right? Get the right vitamins and minerals.
Yep.
And if I don't do that, is that how I get anemic?
Not necessarily. I mean, certain foods might play a role. But I mean, really, anemia should really only happen. So it depends what kind of anemia, right? So if it's from low iron, that should really only happen if someone's bleeding. the body has a very good way of maintaining its iron supply. It recycles iron. Old red blood cells get recycled the iron to new red blood cells. If someone's bleeding, then they lose the iron.
So assuming somebody's not bleeding, how do we make red blood cells? What part of our body is involved in that?
The bone marrow.
So that's the inside of the bone.
The inside of the bone, right.
So assuming that's working properly, you shouldn't become anemic?
So that has to be working properly. You need the kidneys working properly because they make a hormone that helps, that triggers production of blood. So that's important. Important kidneys, enough iron, and just a general health. Not too much inflammation. So there's a few different things.
So how do I change my inflammation? That's interesting. I've never
heard
that.
We have to know. Well, that's like of certain illnesses. So like let's say someone with a lot of infections, serious infections of the bone, like major problems.
So that could lead to anemia.
Yeah, because
I didn't
a lot
know
of
that.
inflammation. Yeah.
And you mentioned the role of iron. That's the iron that I eat in
Yeah.
the foods, or is it a supplement or vitamins or?
Yeah, iron in the foods. Yeah, just today I printed out for a couple of patients a chart with from the New York Blood Cross. It has like an inverted pyramid of the most iron-containing foods, the least. And some things I wouldn't have expected, because I said to him if he ate nuts, and I think he said that he eats sunflower seeds. And for some reason that has a little bit of iron, but sesame seeds have a lot of iron. Go figure, right? So sometimes you don't necessarily know what has what. And that's vegetables, and certain animal products have a lot of iron, like chicken liver has a lot of iron.
So is iron something I should be supplementing my diet with? I mean, I always take I take a multiple vitamin every day. Don't ask me why, I just do it. Is that something that as I get older I should think about taking iron in addition, or is that just not necessary?
Probably not necessary. I mean, unless there's a reason that you're losing iron, mainly bleeding. So, but usually for men, this shouldn't be an issue, or for women who are no longer having who are postmenopausal, no longer having periods, shouldn't be an issue. If someone develops low iron, then without an obvious cause of bleeding, that's a red flag. Say, well, why are they low in iron? Are they bleeding somewhere we don't know about? Or maybe internal bleeding? Do they have to see a gastroenterologist to look inside? So that's, I mean, I wouldn't. Someone should not just be taking iron because, then they might be covering up a real problem. Like. We'd want to know if they're low in iron, because then that needs to be looked into.
So it's blood that's obvious. Obviously, if I cut my finger, I'm going to bleed.
Right.
If I have, something going on inside that I don't necessarily see, I could still be bleeding, correct?
Right, exactly, yeah, because if it's internal, with an intestine, you go to the bathroom, a number two, there could be a little bit of blood hiding, you wouldn't know. You can't see it.
So are these things that my primary care physician should be able to pick up, or is this something that I would have to see a hematologist first to determine that I'm anemic?
Usually, people get their annual physical. They might get blood. It would show on the annual labs that that's a pretty standard test.
So if that's normal, I don't have to rush to see somebody like you.
Usually not. Yeah.
So let's talk a little bit about blood donations. I know this is not your specialty, but it sounds like somebody who specializes in hematology, and particularly in patients with cancer.
Okay.
You probably have a lot of patients who need blood. Is that right?
Yes, that is right.
And that's because of their cancer?
Some cancers, patients do need blood. So certain like leukemia. Certain kinds of leukemias in particular, like acute leukemias where the bone marrow is really not working at all, they need blood transfusions to help them.
And they need transfusions because they're getting treated for their cancer, and that causes them to become anemic. Is that right?
Both. I mean, right. So sometimes it's the treatment can cause anemia. Sometimes the cancer itself can cause anemia, so different ways. And
you mentioned iron as the treatment of anemia. Couldn't people get iron rather than a blood transfusion?
No, that's only if the reason for their anemia is the low iron. So as we mentioned, the factory idea, right? So sometimes you have enough supplies, but no workers, in the factory, or the machines aren't working. So, people with leukemia, for example, often is a lot of iron, but the machinery is down in the bone marrow. It's not functioning. So giving them more iron isn't going to help the anemia.
So it sounds like there are patients that no matter what you do, for whatever reason, as long as they're not actively bleeding, again, I think of something simple like cutting my finger, you're going to put a Band-Aid on it, right? You're going to stop the bleeding. It sounds like there are situations where blood has to be given and it could save somebody's life.
Yeah, that's right. I mean, certain situations, right. So I'm a hematologist, so I treat blood conditions, also oncologist, cancers, so we use blood. But other doctors could be sitting in the same chair talking about the importance of blood donations. Trauma surgeons, for example, someone is in an accident and they get a wound and emergency, they lose a lot of blood. They need the blood emergently. And the OBGYN, obstetrician, a woman comes in, childbirth, sometimes there's a lot of blood loss in the time of childbirth, and they need blood supplies urgently.
That's a very good point. So it's not just somebody who's got cancer.
No,
when we talk about the need for blood, it is to save a mother's life, to save a baby's life, to save somebody, God forbid, is in an automobile accident.
Right.
Why is it that there always seems like there's a blood shortage in this country?
Right. Well, there's an ongoing need for blood donations because the blood products don't last forever. There's a shelf life actually. The blood is made up of different components. So you have red blood cells. That's the part that carries the oxygen, and they can last, I think, up to 42 days on the shelf and refrigerated. But other products like platelets, which are the part of the blood that helps prevent or stop bleeding, they can't be refrigerated, or at least not currently, and it's a 5-day shelf life, and for platelets, and we go through it. You need a constant resupply.
So when you talk about shelf life, I immediately think of the gallon of milk I go buy. It only lasts, you said the platelets are 5 days?
5 days.
And then they have to be discarded?
Then they're discarded.
They're useless.
Useless.
But blood itself is...
Red blood cells, because when someone donates blood, they separate it into its components. So the packed red blood cells are 42 days on
So
the
if
shelf.
somebody, God forbid, is in an automobile accident,
Right.
on the highway right here, they're going to come to our emergency room. They're going to get platelets. They're going to get blood cells, red blood cells. They're going to get both. What are they going to get?
Right. I mean, so I think they have something called, there's a massive transfusion protocol, MTP, where if someone loses a tremendous amount, then they give a certain ratio of maybe, I don't know exactly, 4 units of blood to 1 unit of platelets to 1 unit of plasma products, which is another product. So oftentimes if it's not that emergent, we do a blood test to see what their levels are. So you mentioned the cancer case, so that usually isn't emergency in the same way. Usually we test their blood count and we might see what they need, and then we transfuse them what they need based on the results of the laboratory test.
So it sounds like what you're saying, and correct me if I'm wrong, is you're very judicious with the decision and very careful and very conservative, I guess is a better word, about who gets blood.
Of course, yeah.
But when it's needed, it's got to be there.
Right, yes.
It's again, I'm going back to my milk. When I go to the refrigerator and I want a glass of milk, I want it to be there. And I don't want it to be on the last day of the expiration. I want the fresh stuff. I need it to be there.
Right, that's true.
Back to the question is why don't we have more people donating blood? It always seems to me And correct me if I'm wrong, it always feels like just before Memorial Day, I hear people, the New York Blood Center, say, listen, we're going into a 3-day weekend, we need donors.
Right.
It's July 4th, it's Labor Day,
Right.
you name the holiday.
Well, it's interesting you mentioned about holidays. So I think my understanding, and again, this is, I don't work personally in this, but I looked into this, and it's also, I noticed the same things as you. So because of the whole shelf life thing, so there are certain points where the donor supply might go down. But people might not be donating in a given a certain time period because they go on vacation, right? So, so a lot of their donors, I think, are repeat donors, not like one-time donors. So, it's hard to rely upon a repeat donor around certain time periods because they're traveling and also moving. So vacation times, that might be one point where you might not have as many. Also, disaster times, like we had these hurricanes recently in the southeast. So they came out with a announcement that they had a critical shortage of blood donors, blood supply because of that. People with a hurricane and a lot of destruction, they're not having blood donations, or the centers aren't open, people aren't able to travel. So then they try to, other places in the country, other hospitals, they send blood to that area, and then the local hospital might be a little short. So that might be a reason to step it up a little bit. I think there was an announcement in Brooklyn and other areas to try to donate at that time to help these other areas.
That's very helpful. I never thought about people going on vacation.
Right.
I never thought of that. I just assumed there were more accidents on the highways, and they needed more,
Right.
supply and demand. We need more.
Might be that too.
I didn't realize that.
Right.
I'd rather think it's because the people were going on vacation.
Right.
Do you recommend that people who have no medical reasons not to give blood, do you recommend that people become blood donors?
Right. Well, so it's a hard thing for me to comment on because I have a bit of an invested interest. I want lots of blood donors so that my patients have it. So it's hard to tell someone that they should. But from what donors have reported, apparently, those who do donate have reported that they feel good. They find a sense of, a positive feeling that they're helping their fellow man.
Or woman.
Or woman, of
yeah.
course. Thank you. There's that. There's also, in some ways, it's sort of like a free health assessment because, it doesn't cost you anything. You go there and they check your blood. You find out your blood count because before you donate, they have to make sure that you're healthy enough to donate. So they'll check your blood count. They'll take a brief medical history. You get a good, a quick screening get a sense of how healthy you are, so there's that. That's a positive. But it is important to be cautious about it a little bit in the sense if one does choose to donate, make sure they give instructions. These centers make sure you drink enough fluids beforehand. It's a very safe thing, but still there are some basic precautions, and they also say you can't donate too frequently because you have to give your body a chance to replenish itself, and particularly with more iron. So if someone donates and wants to be a regular donor, they have to make sure that they're really having enough iron because they really have to replenish their own iron supplies.
That all makes sense.
Yeah.
What about? Are there people who you say, listen, as a hematologist, I'm telling you, do not donate, or you should not donate? Are there medical contraindications to donating?
Yeah, so the issue is donating. So one is whether the person who donates, if it's safe for them, and then there's the thing of whether the blood that they might want to donate, is it safe for the person who would get it, right? So I think there's both things come into play. So for them, might be age. So I think you're a pediatrician, Dr. Siegel. I understand adolescent medicine. So I think the earliest age people could donate might be 16 or 17 or something with parental consent, something like that. But too young, it's not safe for a kid to donate. And also, I think there might be an age cutoff in the upper end as well. So, yeah, and maybe someone who has low blood pressure, it probably, I don't think is able to donate, and make sure it's safe for them. And then in terms of whether the blood that they want to donate is safe for the population, to make sure that they get screened for certain infectious diseases that could be transmitted in the blood. So whether they travel to certain areas of the world that might have certain infections, also if they might have certain medications that might be an issue, including a blood thinner. So if they're taking a blood thinner, may not be such a good idea to donate for them. Get pricked, and even the blood, maybe it's easy to bleed or something. So yeah, there's whole lot of things. When I looked more into this, I was very impressed by the way it's approached in the blood banks. I feel like in terms of in the medical profession, it's probably, I don't want to say the safest, but it's really, really up there in terms of how to compare. Makes me think of like the airplane industry. You don't want any plane crashes. So blood donations, you don't want anything to go wrong. Like if there's a single problem that happens with an issue with a blood donation or someone receiving a blood product, it's a major, major problem. So the safety levels are really high. So I feel like people should feel comfortable going to a blood center and knowing that the blood center would probably screen them. And if it wasn't safe, it wouldn't happen. So yeah, so I feel pretty confident with that. So I think if you're not sure, you can always go to a blood center and find out. See what they say.
I love the way you're thinking about this, because I had never thought of it. Is it safe for the person to donate, and
Right.
is it safe for me to receive the blood?
Yeah.
So God forbid I'm in an automobile accident, and the only thing that's going to save my life, I want that blood to be there. So I'm
Right.
hoping somebody donated, so
Right.
it's there, it's fresh, and I can, and it'll save my life. Putting that aside for a second, because I do agree our blood centers do a great job of screening that blood to
Right.
make sure that it's safe for me to get. But I love the way you're thinking about, is it safe for me to give? I remember years ago, I always had men who've ever had sex with men,
Right.
people who've had hepatitis,
Right.
people who I think were from Haiti. Is that true anymore? Do you know?
I think a lot of the stuff is still true. I'm not 100% sure.
Yeah.
I think they are looking into, again, they want to expand the blood donation pool. So I think they're doing research to see about eligibility. I could be wrong. I'm pretty sure I saw a recent study done to see if whether someone who is HIV positive is allowed to receive a donation from another person who's HIV positive.
Correct.
I'm pretty
Right,
sure I saw
right,
that recently.
Right.
And again, just to try to look into expanding the pool. But yeah, a lot of the issues are still there, I think.
But I think the important thing that you're
Yeah.
bringing home is,
Yeah.
if there's a question, if you would like to be a blood donor,
Yeah.
the questions, you can ask your primary care
Right.
internist, or you can go to the blood center
Yeah.
and say, hey, I'd like to be a blood donor. Would you
Yeah.
talk to me about this? And then they will actually do the blood test to determine whether it's safe for you
Yeah.
to be a blood donor. I never thought of that. I've always thought of it more for the person receiving my blood.
Yeah.
So let's talk about
Yeah,
the
just
times
if I cut in for
please.
a second.
Yeah.
I think the thing that I would want to say is, we should feel responsible for everybody, right? The last thing we want to do is to help one patient, we turn another person into a patient.
Right.
Right. So we don't want anyone to become sick,
Right.
right? And actually, as physicians, our first principle is do no harm, right? So it should be do no harm on who we donate to, but also do no harm on who we're taking the blood from. So we have to be careful with that.
Yeah. But I love
Yeah.
your advice, which is just go to the blood
Yeah.
center and say, hey, I'm thinking about this, and they'll help you make the decision that's safe for you
Right.
and safe for the person
Sure.
that you are donating your blood to. It's really a nice way of thinking about
Yeah.
it.
Yeah.
Is there anything else you would say to somebody who's thinking about donating?
Well, I mean, I could just, it's amazing. I've personally been involved with many patients and many times ordered blood, and it comes in a bag. You see a number. You have no idea who it's from, right? But clearly, there's someone who was altruistic, who donated. And I would just say thank you to anyone who's done it or is thinking about doing it. It's really, nothing can replace blood, and we all need it. And so it's just thank you, really.
And thank you for what you do every single day, not just for people who are thinking about donating blood, but thank you for all the patients you save every single day.
Thank you for having me.
And that brings us to the end of our program today. Thank you for tuning in and learning alongside of us. For more information about our show, please visit www.zurmed.com and stay updated with South Brooklyn Health by visiting us online. This broadcast was brought to you by Brick Media in partnership with New York City Health and Hospitals South Brooklyn Health. Until next time, be safe and stay well.